Can diverticulitis cause septic shock? Imagine a tiny pouch in your colon becoming inflamed or infected. That's what happens in diverticulitis. While many cases are mild, complications can sometimes turn serious. When a diverticulum, which is a small pouch in the colon wall, perforates or ruptures, bacteria from the colon can escape into the abdominal cavity or bloodstream. This can lead to a severe infection called sepsis. If sepsis worsens, it can cause septic shock, which is a life-threatening condition. Septic shock happens when the infection triggers a widespread inflammatory response, causing blood pressure to drop dangerously low and organs to start failing. In cases of diverticulitis, septic shock most often results from complications like a perforated diverticulum. When the colon wall is perforated, bacteria and waste can spill into the abdominal cavity, causing peritonitis, which is an infection of the lining of the abdomen. This can quickly escalate to sepsis if not treated promptly. Another complication is abscess formation, where pus collects in the tissue. If an abscess ruptures or spreads, it can lead to systemic infection. There are also rare cases where infection causes blood clots in the veins draining the intestines, leading to septic thrombophlebitis, which can further spread infection and cause sepsis. Medical reports have documented cases where patients with perforated diverticula develop severe infections and septic shock. These situations often requiring emergency surgery to remove infected tissue and antibiotics to fight the bacteria. Early diagnosis is crucial. Doctors typically use imaging tests like CORT scans to identify complications. Recognizing signs such as fever, rapid heartbeat, low blood pressure, and mental confusion is vital for prompt treatment. People with weakened immune systems are at higher risk of developing severe infections from diverticulitis. They may experience more aggressive disease progression, making quick medical intervention even more important. While uncomplicated, diverticulitis usually responds well to antibiotics and supportive care. The presence of perforation or widespread infection significantly increases the risk of septic shock. In summary, diverticulitis can indeed cause septic shock if complications like perforation, abscesses, or systemic infection occur. It's essential to seek medical care immediately if symptoms worsen or if there are signs of infection spreading. Proper management with antibiotics, imaging, and sometimes surgery can prevent the progression to septic shock and save lives. Always consult healthcare professionals for personalized advice and treatment options.